Good morning, good morning. Welcome everyone to day 2 of the National Forum on Australia's Wellbeing here on beautiful Ngunnawal country. So this is the best time slot, I think, for this interactive session. You're all caffeinated, if that's your drug of choice. Hopefully you slept well and you've got a whole day of conference stretching out in front of you, full of possibility and conversation and all kinds of things. So, good to be here. So in this session, we want your help. Yesterday, we learned a lot about the state of our well-being in the country and globally, and it's not good. That's for those who weren't here yesterday, that's my wrap-up. And we heard a lot of evidence on what's driving the social, the economic, the political factors that are driving trends in wellbeing. So hopefully you've had a chance to mull that over and talk about it, because this session is really about getting your input to set the focus and priorities for a very exciting new research translation centre. So before we get you busy working, we're going to hear from our very illustrious panel to set the scene for us. We're going to hear from Professor Sharon Friel. So Sharon is an Australian research... What's the C stand for?
Australian Research Council.
Council, thank you. Laureate Fellow and Professor of Health Equity at ANU, and is also the Director of the Planetary Health Equity Hothouse, which sounds like a sauna that maybe we could all go to. It's not a sauna. From Bonnie Matheson is the Manager of Commercial Determinants of Health at VicHealth, which is not the Department of Health in Victoria. Just want to make that clear. We'll reiterate that again if people forget. And Professor Gary Sachs, who's Professor of Public Policy at Deakin University in Victoria, and also co-director of the Global Centre for Preventative Health and Nutrition. So, I'll invite... Oh, there they are. There they are, and here they are. First, I'll invite Sharon up to set the scene for us.
Thank you, and thank you so much for the invitation to be part of this. I have FOMO because they have this new centre and I'm not part of it, and I'm really sad. So, but I want to be part of it, please. So we're speaking about this. There's a field called the commercial determinants of health. For a long time in the world of health, well-being, health equity, there's been attention to, or a real focus on, what is it that government can do or causing harm. And in the sort of the world of public health, there was a bit of an orientation to say, okay, well, what about particularly corporate actors, not just corporate, but all sorts of commercial actors, and how do they fit in the puzzle that affects our health and our well-being? And a lot of the work has focused on a whole range of products. Some of them you see here on the screen. And that's been fantastic, and it's demonstrated. You can see about a third of global health deaths come from just four industries, 4 products listed there on the screen. What we've been focusing on in the hothouse, it's not a sauna, it's a really serious research centre, is looking at what we call the consumptogenic system, and it's really placing those commercial activities in this much wider system, which is what Gary and colleagues are focusing on as well in the new centre. And the way we describe this consumptogenic system is really what we were speaking about yesterday, this web of different actors, different institutions, different commercial activities, different norms that are baking in the excessive extraction, production, consumption of fossil fuel goods and services, and that's really bad, of course, for the environment, and incredibly bad for human health, and very unequally distributed. So the commerce is right there in that system, and interacting, of course, with a whole load of other things. In the world of the commercial determinants of health, we have very explicitly identified a number of universal practices that are used by different entities. Some of the practices are not listed here, but some are really good for health and well-being. We have tended to focus on those that are really bad for health and well-being, and some of them are listed there. But I put that up really just to point towards the many opportunities through which commercial entities can both positively and negatively affect health and well-being. So every day we see marketing, advertising that tells us to eat more, drink more, blah, blah, blah. Yeah, we're very familiar with the marketing practices. We're hearing an awful lot about science, misinformation, disinformation, the funding of front groups that many of these corporations partake in. That's all about undermining some of the actions that really must be taken to improve our health and well-being. Don't worry, I'm not going to go through all of them. One of the ones, though, that I think is the most egregious is the corporate political activity. And this is where commerce, policy, and politics intersect beautifully in a bad way. Because what happens through the lobbying, through the donations, through the being in the rooms, is about absolutely reinforcing the social license to operate. The politicians love the corporations, the policy folks love the corporations, the public love the corporations, and so therefore we won't touch them. We give them their social license to operate. Why on earth do you think we have new fossil fuel projects in this country? So part of what, in trying to understand how to improve health and well-being, and I would say planetary health equity, we've got to pay attention to some of these commercial practices. And so what the centre, I'm pretty sure we're going to spend time talking about this, is really trying to understand the role of commerce in 21st century societies. And how do we get to the place where market actors, commercial actors, are regenerative? Their business is not just about excessive profits. Their business is about improving the social, the mental, the environmental well-being for everybody. So that's the challenge, I think, for us. There's the challenge for the centre. How do we pay attention and make these sorts of commercial entities the norm? Yeah?
You can pass straight to Bonnie.
Straight to Bonnie.
Thanks, Sharon. That was a really great sum up of the big challenge ahead of us, and one that we want to invite you all into. So thank you for joining. So I'm Bonnie. I manage the commercial determinants of health team at VicHealth. Before I begin, though, I'd like to acknowledge country and pay my respects to elders past and present of the beautiful Ngunnawal country that is quite humid today as I was walking through the campus grounds. And I wanted to pay my respects not just to Aboriginal people who might be in the room or all First Nations people, but also pay my respects and am thinking about future generations of Indigenous peoples that are yet to come, and the sort of, legacy I think we can all be a part of creating. And for me, I was just thinking yesterday, we're Victorian based, and I think the truth-telling and treaty process that's happening right now in Victoria is such a great example of how, much like the economy, the structures that were built under colonisation that continue to today, they were built to serve the interests of white people. And just like the economy, they can be rebuilt. And that's, I think, a big part of what the treaty process is doing. And I think that could be a really exciting blueprint for how we can potentially reshape aspects of the economy. So it's just some food for thought there. So for those who aren't aware, VicHealth was the world's first health promotion agency funded by a tax on tobacco. So yesterday Lorenzo was talking about his fight to bring in a sugar tax. Well, we at the time we were taxing bads, tobacco, to create the entity that now exists as the Victorian Health Promotion Foundation. So yesterday I was just thinking about our lovely colleagues at the Foundations for Tomorrow, and I think I saw Amy somewhere in the room. And we were encouraged to ask, what do I want to be thanked for by future generations? And at VicHealth, I think it is what you're seeing on the screen. And this is about delivering a healthier and fairer Victoria. And indeed, I would suggest we're all interested in Australia and even maybe the world. So that's what we're aiming to do at VicHealth. And how we're doing that is by reshaping 3 systems. And they're on the screen there. So there's the neighbourhood and built system, the commercial and economic system, which is the team that I look after, and I've got Miranda in my team in the room here, and the food systems. So we're working and really structured it to work across all those systems. I'll be focusing mostly on that middle system there. And I just wanted to point you to one of our 10-year aspirations around the economy. So Catherine Trebek yesterday, for those that were here or inline or online, challenged us to think about being fussy about growth. Well, our fussiness is we want to deliver at least $1 billion in benefits to the Victorian economy and society by 2033. I had to double check, was it billion? Yes, $1 billion. So we want to be able to showcase that the work that we're doing in concert with many of you in the room can drive that benefit for the economy. So, went too far. Okay, so you might think, how are you doing that? That seems big and scary. That's what I think every day. We're working towards 3 outcomes in the commercial and economic system and 3 focus areas. And I'm not going to speak about the outcomes, they're up there, but to give you some tangible examples, we are working in the tobacco, vaping and other nicotine products space. So we're working with partners like Quit Victoria and the Victorian Department of Health to drive world-leading vaping and tobacco reform. So we want to make sure that people are less exposed to those harmful industries. The second area of work is we convene coalitions for change. And looking out into this room, I can see Warwick from CPD. So we're doing some work with the amazing crew at CPD. So thanks, Warwick. Amy, Foundations for Tomorrow, we're supporting some of the great work that you're doing as young leaders, but also encouraging us to think about future generations yet to come. We also work a lot in building coalitions across otherwise sort of separate areas. So often you find people working maybe tobacco control or gambling control, alcohol control. But as Sharon pointed out, often the tactics used by corporate actors are exactly the same. So what happens when we join forces and actually build coalitions? So we're doing work with the Foundations for Alcohol Research and Education and other great partners. And then the last area, which I think has probably come up the most over yesterday and no doubt the next couple of days, is the wellbeing economy. And again, CPD, Foundations for Tomorrow. Also, Mount Alexander Shire are doing some really great work in Victoria, trialling a wellbeing economy approach. Well, they're not even trialling it, they're doing it in a very small local regional area and are really trying to change the way that area thinks about the economy. So check them out if you haven't heard of their work. And also we're working in 2 areas south or around Geelong, Corio and Norlane, with neighbourhood economics. They're also, Bill and Annie, I'm not sure if they're in the room. Oh, hey, Bill. They're doing really incredible things to think about how working within the local economy can we actually shift disadvantage. So Coraio's the postcode with the lowest socioeconomic index, I believe, in the state, and Bill and Annie are just doing incredible things to rethink the economy in that local area. So yeah, doing some cool work alongside you guys. We've got a research fellow who's looking at wellbeing economies in practice, Melissa Kennedy, so look out for her. She's, oh, hi Melissa. Yeah, chat to her if you want to know more about really exciting work that's happening again in Castlemaine, Mount Alexander Shire. And then Miranda's leading some work to create a framework for us on how do we engage with corporate actors, because as a public health agency, we're often very averse to working with corporate actors. We kind of worry about conflicts of interest, which are real, but we think it's really important that we actually get business in the room. But be mindful of who we talk with and what are the risks, but what are the opportunities, as Sharon mentioned that word. So we're hoping to create a framework for VicHealth that potentially could be useful for others in this room. And we're also researching on what a health promoting business could look like. So we're doing some partnership work with Swinburne on the kinds of businesses that we want to support. So look, that's just a tiny little flavour of some of the things that we're doing in practice. And if you are interested in talking any more about those, I'd love to chat in one of the breaks. One project that I haven't mentioned is the Research Translation Centre, because I don't want to steal Gary's thunder. So with that, I will hand over to Gary to talk more about the centre and how you can be involved. Thank you.
Thanks, Bonnie, and thanks for everyone for choosing this session rather than the boring other one over there. Let me tell you. Let me work out how to push the button. They make it really easy, just 2 buttons, and still I'm struggling. So what is this new centre? It's a joint venture between Deakin Uni and VicHealth, and I think it shows a lot of courage and leadership from VicHealth that they're willing to fund a centre in this area, and they've put what is in this field quite a lot of money. It amounts to $8 million over 5 years into researching how businesses can work for health. And so I feel very lucky to be in the position to lead the centre. And so I'll tell you a little bit about it. As we've said, the aim is that we create an economic system where communities are thriving and they care about health and environmental sustainability is considered. Our role in that is to facilitate research translation. So taking existing research as well as new research that we'll conduct and putting that into practice, trying to speak with policymakers, speak with community groups, and get change. There's a lot of people in the room and elsewhere that are also working to get change in this area. So we recognize a key role that our centre will have is bringing people together, working out how best to tackle, how best to get change. We deliberately have what we're calling a transdisciplinary team. So I work in health. There's people from the Faculty of Business and Law, people from humanities, so all across Deakin, and we'll be inviting a whole lot of other researchers to collaborate. So trying to get at this from multiple angles. You might recognize a few people in the room who are involved in this work. At the moment, we're conceiving our work as fitting across 4 streams. I'll just briefly touch on them. One will be monitoring what corporations are doing. A second stream is how do we create policy and regulatory change around the way corporations, the systems they operate in. How do we incentivize investment into business models for health, which touches on some of the aspects that Bonnie just mentioned. And we have an Indigenous health stream as well. But across that, we have a strong focus on community engagement, including, when I say community, defined broadly, policymakers, NGOs, businesses, academics. So trying to meet people where they are and figure out how to get change. fitting for this conference. The wellbeing economy will be like an overarching framework for us. As I said, community engagement will be critical. So it's about the research translation. I think the key to that is, as I said, meeting people where they are, trying to collaborate with others. $8 million sounds like a lot, but it's, by the time you spread it out, it doesn't amount to much. So the more we can do together, the better. Where we're at in the centre is these first few months of the centre is an establishment phase where we figure out our priorities. And so sessions like today, where we're hearing from you about where you think we can create change, where you think we can focus. We'll be doing a lot of that over the next few months. So this is a really critical session for us, actually. We want to be, we're explicitly going to be measured on what impact we had. So in 5 years' time, VicHealth are going to decide whether to fund us some more or not. And to do that, we need to show we've actually made a difference to the world in some way. So what we're hoping to spend the next half hour on is hearing like which policy areas, what can we realistically target, where should we spend our time? Yeah.
That's right, and maybe perhaps, Gary, it might help to give people a couple of examples of the kinds of policy areas that you're interested in.
So there's a couple of ways of thinking about this. So the key thing that I want to get out of this for our centre is, in 5 years' time, what could we point to from a policy point of view where we could realistically expect some change, and how we can show the centre's contribution to that. And by policy area, that could mean many things. It could be, say, a change in a policy agenda, so I guess more focus on the wellbeing economy at either federal, state, or local level. Or it could be really specific. So, for example, Bonnie mentioned protecting children from marketing of unhealthy food or unhealthy products. Maybe that's an area where we could, if we focus on that, we may be able to show a change. It could be something like corporate governance as a general topic area where we could try to target some specific changes. When we hear from the group, you can go really specific as to like one particular policy opportunity that you think we could really push hard on, or it could be more general about a policy agenda. Is that,
yeah, thank you. One question over here.
I was wondering if you could put up the slide you had before where you had your 3 focus areas, because that could inspire us.
Great. We can bring this up as well while we're working through. Thank you all. So, as Gary said, we want your help on these 2 key questions. Where should we focus? There's so many things that this centre could do. So help us focus. And who should we work with? If you want to get involved, or you think there are others out there who might want to get involved, we'll come back to that at the end. So we thought it could be helpful to think about these 3 criteria when thinking about what should the centre focus on. So when you're working in your groups. So 3 criteria are impact. How significant is the impact of this particular issue on people's lives? If we can address it, will that make a really big difference? The second is issue centrality, which is a bit of a mouthful, but essentially how central is the issue? If we tackle this issue, will that have positive knock-on effects to others? I think one example I thought of, which is hopefully correct, is if we addressed kind of corporate funding and lobbying and the mechanisms around that would have an impact for many, many different areas of society. Is that about right? Yep, great. And then feasibility. How feasible is it that we could meaningfully make a contribution? And we might be thinking about there is an opportunity or there is appetite within government to make a change here, and we could get something done within this time frame. So we've overrun a little bit in the kind of when we were all in the session, so we've got a little bit more time. We're doing well. We want to spend about 30 minutes on this. And for those, we'll have some people online as well. So for those who are in the room, we want to organise into small groups. Tick, that's done. We're going to spend time brainstorming policy areas. On every table in the room, there are some pens. You've got your own pens. There are sticky notes. We want you to just brainstorm. Then I also want someone at each table to put up their hand to draw 3 beautiful circles in a Venn diagram like the one here. And I need a hand up just to make that quick. Who's going to do it? Yes, the artistic people. We've only got 2. Yes, yes. Someone at the back. You can do it. Someone, yes. Someone here. Could draw a circle. Yes, okay, that's good enough. So 3 circles. We want you to first brainstorm ideas. You can all do that on your sticky notes. And then I'll give you a little time shout out to try and place them on that Venn diagram if you can with those 3 criteria. You're trying to get in the middle. And then I'd like you to have a conversation as a group. What do you feel are the most important that you think the centre should focus on, and give those a big tick. And then we'll have time to report back. For those who are online, you could use Slido. I've got Slido logged in on my phone, so please use Slido to brainstorm ideas and upvote those that you think are great, and then we'll have a look at those as well. So yeah, and we will disperse ourselves and answer questions. So go ahead, brainstorm away. So by way of reporting back, we'd love to hear any tables who are willing to share any top priorities that came out of their conversation. Just 1 or 2. And we'll bring a mic over. Anyone brave enough? I'm bringing the mic for the online folks. There you go.
All right, so we had a pretty broad-ranging conversation which really thought about the strength of the centre, who you've got working with the centre, and conflict of interest. I'm at Deakin, so I know the people well. But one of the areas we really talked about was food security and optimising the access of healthy foods to all Victorians across the life course, because if you can get that right, then it'll have both significant effects on both physical and mental health, but it'll also have significant effects on the healthcare costs and the system. So it's a big meaty area because it covers things like the commercial drivers of food availability, advertising, food choice, and the like. So if you can nail that one, Gary, I think that would be a really great start.
Go for it, Gary. Anyone else? Right here?
We had quite a long conversation about mental health for kids and harmful product marketing to children, and then obviously got into quite a big conversation about the internet and regulation. The fact there's already a national conversation here about access to social media for children means that door is kind of open already. But then we had it's a very complicated area, but one of the things that could be really helpful could be more kind of educational, some kind of campaign targeted towards parents around what to look out for in your children, signs of, at the moment parents are kind of pretty blind on the subject, so there could be something useful in there.
Awesome. Thank you. Take 1 or 2 more right over here.
Thank you. We had a couple of conversations ranging from raising the drinking age from 18 to potentially 21, and also picking a pretty small policy agenda for you, the tax and transfer system, which I'm sure you'll sort out pretty quickly. But just thinking about the possibility with, we think, a federal government that's in maybe for another election cycle as well, and what true reform of that system would look like to be more progressive and change the distribution of, raise different revenue and change the distribution of that revenue.
Awesome. Big aspirations. 1 more. Burning? Any more burning? Yes.
We started by talking about some more of the, industry-based issues. We talked about food security, as well as in regional areas, just there isn't, KFC, McDonald's is where you hang out because there's nowhere else to go. So the kind of systemic drivers behind that. So then we sort of zoomed out and sort of thought, well, what is actually enabling that in the economic system, that we prioritise private assets over public assets? So can we zoom out and fix the economic system is basically your job now.
Great. $8 million to fix it. That's a bargain. Wonderful. Thank you, everyone. So I've also say we've got a couple of comments on the Slido. One from Daniel. Healthy built environments and communities through local government, statutory, municipal public health and wellbeing plans, implementing research and evidence interventions at the local level. And another comment around how state governments can contribute to food policy when most of the drivers are at the Commonwealth level. Another challenge to face there. Great. Thank you for all your thoughts and conversations, and the team will take away the sticky notes and the Venn diagrams and digest that further. We've got another almost 10 minutes. So the second question we wanted to talk through was, who should we work with? So we'd also love you to capture on your sticky notes or in the Slido chat if you're online. We'd love to know if you're working in these areas and you're not yet involved, would you like to be? And chuck down your name. Is there anyone else or any other institutions that you know of who you think would be really interested in doing this work and who could collaborate with VicHealth and Deakin? And is there anything else? Any other resources, research, frameworks, etc.? Whatever you think would be helpful to put these guys in touch with. You can also email Gary at his email address there if you want to get involved. So we'll give you a few minutes to do that, and then we've got a bonus last minute question to chuck at you once we've done with that. Okay. Thank you, everyone. Lots of deep conversations, lots of note writing. If you have any more ideas or questions about anything we've discussed today, come find Gary, come find Bonnie. They'll be easy to find. There's only 2 rooms in this conference. We had one more last minute question we wanted to throw at you, so I'll bring Gary up to test that.
While we're getting input from experts such as yourselves, I want to talk about the name of our centre. So as much as the name Research Translation Centre into the Commercial and Economic Determinants of Health is very compelling, we do want a new name. So we have been asking a few people on that, and there's one name that I want to run past you to just gauge your thumbs up or thumbs down to this name. And then if you think of others, I think we can have hands up or on Slido. So the name that's rising to the top is to call ourselves Health Inc., with the tagline, incorporating health into how businesses work. So my question to you for thumbs up or thumbs down is, what do you think of the name Health Inc.?
Literal thumbs. It's a mixed. I mean, more people. We need more people in the room to participate in this democratic process. Wow, it's a real mix. It's like a 50-50. So then the follow-up question is, other names. There's no stupid name. Wellbeing? Wellbeing Inc. Wellbeing Inc. Health Best. Health Base. Health Base. Let's get others going. It's a yes and vibe, whatever. Health and Wellbeing Base. And Gross Health Product, GHP. I love it. Great. If you're on Slido and you're online, chuck in some more ideas and we'll have a look at those as well. If that's the last of it, I think. Did you have any other questions, Bonnie or Gary, for the team, for the group? Bonnie's going to come up.
Just if you've got a cracker of a name, write it somewhere on your a post-it note so we don't lose the gold. Thank you.
Great. All right, thank you, everyone. That is... Yes, Kate. Oh, wow. So academic. I love it. Great. What was your research methodology? Oh, someone else? Great. The Research Translation Centre into the Commercial and Economic Determinants of Health. Yes.
Yeah. The question is, how will we incorporate youth voice into this? We have a really solid plan that it's going to be integrated across our whole work program to integrate youth voices in multiple ways. There's a few youth organisations we're already working with, and we hope to work with others. So I don't have detail yet, but that's on our radar for sure.
There was also a comment in Slido that we must include education systems so we can influence young people early. So there's an interest in the group on youth. Kate.
Yeah. So the comment was, so why are we only hearing about this now? Why haven't we been involved yet? This is really new. We've only been going a few weeks, and we're just getting our stuff together. And sessions like this are just the start of our consultation. We will reach out to people.
Great. Thank you, everyone. Please put your hands together for our wonderful panel. And come find them if you want to get involved, have questions. And yeah, we will go on to the next session to choose your own adventure today. So have a great day. Thank you.